Cold is one of the most common contractile disease. Unlike Western medicine, which regards a virus as the cause of cold, Oriental medicine considers cold is from external pathogens such as cold wind and weakened body. In Oriental Medical Digest today, we'll talk about how the prevention and the care for the cold are handed down for generations in the East.
Oriental medicine regards weakening in the body's resistance to disease due to Punggansagi as the cause of cold. Punggansagi means bad 기운 that comes from being exposed to wind and cold. It penetrates the body easily when ki and blood circulation is weak. The medicine that the hospital prescribes for cold can relieve symptoms and soothe the tension or pain, but that does not mean that the cold itself has been cured. Slight temperatures below 38.5 Celsius degrees are a sign that the body's interferon is fighting against the sagi that has come into the body. In such cases, taking antifluvials can actually kill the interferon. The interferon will interfere with the body's resistance to disease, indirectly helping the sagi to become even more active. Healthy bodies can easily overcome the interference of antifebrile. However, the antifebrile weakens resistance to disease in frail bodies, and complications may occur.
The bad ki of wind and cold, called Pungsa and Hansa, penetrates the weakened body and causes colds. Therefore, treatment involving driving Pungsa and Hansa out of the body. When there is fever without perspiration, Mahwangtang is prescribed. For patients who perspire profusely and complain of aching muscles, Kejitang is prescribed. For bigger aches, Sosihotang is prescribed.
In Oriental medicine, each individual's constitution is considered when prescribing medicine for colds. Diagnosis involves a series of steps. Firstly, the physician looks for visible symptoms. Secondly, he asks the patient questions about his discomfort. Thirdly, he uses his senses of smell and hearing. Lastly, he feels the patient's back, stomach, and pulse. Mahwang or geji, which can be extracted and send out sagi, is always included in prescriptions for cold.
초기에 열이 날 때에는 땀을 내서 치료해 주는 방법을 쓰는데 땀을
At first, the method of inducing perspiration is used to relieve fevers. Inducing perspiration is a common way to drive out saki from the body. Usually, medicines such as Mahwangtang or Kegitang are used as diaphoretics to drive out saki. Besides this, pemo or panha is used to resolve phlegm. Also, fever is brought down with shiho or hwangum. Another common symptom of cold is aching all over. For this symptom, kamhwal or tokhal becomes the main ingredient in the prescription.
The purpose is to enhance ki circulation and relieve the mental fatigue that afflicts many people today.
감기 증상에 치료 방법은 여러 가지가 있습니다.
There are many ways to treat
지금 이
colds.
환자의 경우에는
This patient is showing signs of 실증,
실증이 있어서
and so
치료해 주기
will be
위해서
applying
침 치료
acupuncture
방법을
to treat
쓰는데,
his symptoms.
감기의 침 치료 방법에는 바람을
합곡혈,
시켜주는 합곡혈을
The acupuncture point that has diaphoretic effects is used in this case.
손,
Hapkokyol
엄지와
is the valley that lies
검지
between
사이에
the forefinger and thumb,
계곡입니다.
where the skin is
갈라져
divided.
있는 부분이죠. 이 부분을 합곡혈이라고 얘기를 합니다.
As
지금
this
또
patient is
실증이기
showing
때문에
signs of 실증, will push
합곡혈에다가
in the needle
침을 놓아서
and turn it gently to the left.
가볍게 왼쪽으로
This will make the whole body perspire and drive out the saki that has entered the body.
외감 사기가 빠져나가도록 하는 방법을
This saki,
이런
which is
경우
the cause of the cold, will be driven
땀과
out
함께
together with the induced
감기의 원인이
perspiration.
되는 사기가 몸 밖으로
In this
나가면서
way,
감기가
the
낫게
cold will be cured.
Aromatherapy is used to supplement the treatment for colds. Aromatherapy uses essence oils extracted from plants. Peppermint, which suppresses the growth of bacteria, is used for the fast relief of colds.
이것은 감기를 일으키는 나쁜 기운을
This therapy makes use of the aroma of herbs such as peppermint to weaken the forces of saki,
한약재 중에서
strengthen the body's resistance to disease, and strengthen the respiratory system.
깊게 숨을 들이쉬어서
Breathe in
향기가
deeply to let
아주
the aroma
깊숙이
in.
들어가도록 숨을 쉬십시오. 바로 기관지
As the
깊숙이
herb's
한약의
aroma
향기가
goes
들어가면서
deep into the respiratory
기관지의 기능을
organs,
강화시켜주고
it cures colds
감기를
by
일으키는
strengthening
나쁜
the
기운을
respiratory
밖으로
organs'
내보내게
functions
해주는
and
효과가
driving out saki.
Ingredients traditionally regarded as good for cold are spring onions, ginger, Chinese quince or mogwa, and omija. They work best when boiled, as boiling releases the essence of these herbs, thus increasing their effect. Once you get a cold, drink barley tea often to absorb moisture. Cold milk can thicken mucus and phlegm and makes discharge difficult for some people, and so should be avoided. Also, bathing makes the body go through sudden temperature changes, thus exposing it to hangi or cold influence.
Although cold is a disease itself, severe cold can be the start of many life-risking illness. To prevent catching a cold, most important thing is not to expose yourself to the cold wind and evil pathogens. And always keep your body warm and try not to walk under the rain. Thank you for joining us and see you next time.